Good morning, everybody. Welcome to the Medi-Cal Dental Program webinar we will be discussing coverage and language access rights. I will give folks a minute or so to hop on, but just to begin with, we will have Amber Christ from Justice and Aging as a panelist, myself, Carolina Valle, with the California Pan-Ethnic Health Network, Dorina Wong from Asian Americans Advancing Justice, Los Angeles, and Mariana Yamamoto from Asian Americans Advancing Justice, LA as well. So thank you all. Super excited for this webinar. Next slide. These here are the 4 organizations that are sponsoring this webinar. You have quite the panelists of experts here: Asian Americans Advancing Justice in Los Angeles, California Pan-Ethnic Health Network. We have offices in Oakland, Los Angeles, and Sacramento, Justice and Aging, and Maternal and Child Health Access as well. Next slide. So as we begin, I just wanted to go over a few housekeeping items. All of you will be on listen-only mode, but we do encourage this to be a learning environment, so please use the questions feature on GoToWebinar platform. It should be on your right to share any questions, any perspectives you want to share, and resources as well. Again, you're in listen-only mode. This webinar will be recorded. Slides and recording will be shared after today's webinar, so please watch out for that so that you can share with your own partners and network. And then we will have 2 poll questions, one at the beginning and one at the end. So please take a minute to look out for those poll questions. It will really help to inform our work moving forward. Next slide. So here's just some pictures of your panelists. We are on a virtual platform, so it's nice to know who our panelists are. Next slide. So just a quick overview of our agenda, and then we will have a poll question. So we are going to be starting with an introduction about why oral health matters. And then we will discuss the basics around Medi-Cal dental coverage. The third section is appeals. So we will be talking about what you do when you encounter difficulty or a problem accessing language assistance services. And then the fourth section is on language access rights. So what are people entitled to, and how can they ensure that they get access to care given that these are their rights? Then we will talk about community stories, and so this is a really important opportunity for you all on the webinar to reflect on your own experiences getting language assistance services. And if you can relate to any of these stories or want to share your own, we welcome you to do so at the end during our discussion. And then lastly, we will talk about resources before we go into discussion. And so resources around where to get help, who to call. Consumer advocates play a really big role in all of this work, so we will be sharing that at the end. And then we will go into discussion where folks can share their own stories, their own questions, and other things that they would like to flag for the group around this issue. Poll number 1, please. Great. So you see here our first poll. So we just like to hear from all of you on the webinar about whether you've ever encountered any difficulty accessing language assistance services in dental care. And this could be either for yourself, it could be for a family member, or it could be for a client or consumer in your community that you've worked with. Here, we weren't able to pull up the screen, but it's about 50-50. So about 50% of you said that you have encountered challenges, and the other 50% shared that you hadn't encountered challenges. So we have a mix of experiences here in the room, and that will be really important as we discuss about any future experiences that you might have, any success stories that you'd like to highlight, or any challenges. And next, we will introduce Amber, who will talk about coverage basics.
Great, thanks, Carolina. This is Amber Chris with Justice in Aging, and I am located in our Los Angeles office, and I'm the director of our health team. We started an oral health project about almost 4 years ago now, and really felt that it was an important project because older adults and who are our focus population were telling us that they were having access issues to oral health. And oral health matters. We know now that oral health and overall health are very much linked, and that healthier mouths equal healthier people and stronger communities. I think historically, oral health has sort of been this carved out benefit or carved out service, and we thought about it separately from overall health, but we now know that oral health is very much linked to our overall health. Next slide. You can see in this very small texted graphic, this is about how oral health is very much connected to our overall health. And just to draw some examples out from this, it's, poor oral health exacerbates chronic conditions like diabetes and heart failure. It can lead to aspiration pneumonia, which are increased infections, which often is aspiration pneumonia, which leads to increased hospitalizations. And a lot of times it's bidirectional in the sense that poor oral health will exacerbate a chronic condition, but then a chronic condition will also make your oral health worse. And so without interventions, that just kind of builds on itself and has huge implications. And this is across populations and across the lifespan. So health issues arise and can be in pregnant women and passing bacteria onto their children and sometimes unborn children, so that they're at higher risk for caries and oral health disease. It can lead to obviously increased hospitalization, missed school days, social isolation, and poor quality of life. So oral health and good oral health has a really big impact on people's lives. Next slide, please. Today, we're really focusing on the key to oral health, that is dental insurance. But I just wanted to put this up here that we think of kind of access to oral health or keys to good oral health in a number of buckets, including sort of these preventative things like access to fluoridated water and dental sealants. But really, access to care is a major one. And so today we're really focusing on how the California Medi-Cal dental program operates. And we will discuss both the basics and appeals and then the language access rights within that program. Next slide. So coverage basics in the Medi-Cal dental program. Next slide. So we used to call this Denti-Cal, but the state has really is trying to get away from that and call it the Medi-Cal dental program. Calling it Denti-Cal made it sound like it was some separate program, and the state is working hard to integrate dental into the Medi-Cal program overall. So we are now calling it the Medi-Cal dental program. And this is just a slide outlining the basics of the program. Mostly throughout the state, you receive your Medi-Cal dental services through fee-for-service, meaning that you can go to any provider who accepts the Medi-Cal program. However, in Sacramento County, you are required to join a dental managed care plan to receive your Medi-Cal dental benefits. And in Los Angeles County, you have the option to join a Medi-Cal dental plan. And those three health plans that are required in Sacramento and optional in Los Angeles are Access, HealthNet, and Liberty. So those are the three dental plans operating in both Sacramento and Los Angeles counties. The difference between fee-for-service and managed care is obviously in fee-for-service, the provider network is open, and in managed care, you have to go through your health plan and contracted providers with that health plan. In terms of coverage, we saw in 2009 that coverage for adults, which is an optional benefit under the Medicaid program, went away because of the budget, because of the recession. So adult dental benefits were eliminated in 2009. They were then partially restored in May of 2014. Unfortunately, that restoration didn't include some major services, like, for example, root canals on the back teeth were not covered, partial dentures were not covered, gum treatment was not covered. Thankfully, as of January 1st of 2018, all of those benefits were restored. So we now have full benefits for adult Medi-Cal recipients as well as children. It's important to note that residents of nursing facilities and intermediate care facilities have always had comprehensive dental coverage. They did not lose access when the adult dental benefit went away. And then pregnant women with restricted pregnancy-related or full scope Medi-Cal also have full dental benefits. And children actually have a little bit of different coverage. And if you go to the next slide, actually, can we go to the next slide? You'll see here a chart that provides a quick reference guide, and you can see how all of the different populations are covered for each of the different types of benefits. If we go back to the previous slide, I'll go through some of those with just a little bit of detail. So exams are covered for adults, 1 cleaning is covered per year, fluoride treatment, X-rays. It's important to remember that dental benefits are not, they have to be medically necessary, but you don't get them every time that you might need them. There are scope of coverage limitations. So for example, you are going to get a crown every 3 years. So even if you might need it before that, you might not get it because there's a scope of coverage. We don't really see that in other Medi-Cal covered benefits. It is really unique to dental that you can only get things every so many years. Like if you had a knee replacement and then you needed a knee replacement a year later, you would get that knee replacement because it was medically necessary. Unfortunately, in the dental program, that is not the case. There are scope of coverage limitations in terms of time. I want to point out that with the restoration of benefits, gum treatment was restored, which is particularly a big deal for individuals with chronic conditions like diabetes. Those infections can have really big implications for those conditions. Root canals are now covered on the back teeth. Partial dentures are now covered. Some lab process crowns are covered in limited situations. It's also important to note that no implants or orthodontic services are covered for adults. So next slide, and then the slide after that. One more, yeah. So the dental coverage cap. So in theory, there's an annual dental cap, but it's a soft cap, and it's $1,800, meaning that the Medi-Cal dental program will only approve services up to $1,800. And the provider is supposed to check the dental cap prior to rendering services to determine the remaining balance. Then if you reach the cap, medically necessary services can still be approved. It just has to go through the pre-authorization process, and the provider has to do possibly some additional paperwork. Most dental services do already require prior authorization, so this isn't a big deal, but it's just important to keep in mind to know that that soft cap is there and that the provider should be checking that each time to ensure that they are doing what they're supposed to be doing with regard to the necessary paperwork. Next slide. With regard to the coverage cap, there are some major exceptions to things that are not included towards that $1,800. So emergency dental services are not included in that cap. You could see where if you went to the emergency room once, your entire the $1,800 would be gone. Services that are federally mandated, so there are certain benefits that are covered under the Medi-Cal dental program that you get no matter what. These are usually services that a doctor could provide. So for example, if you needed your tooth extracted, these federally mandated services do not count towards the cap. Dentures do not count. Again, they would eat up the entire amount of the cap, and some additional services listed here. Next slide. The co-payments in the dental program match those that are in Medi-Cal overall. So you have non-emergency services provided in an emergency room, it's $5. Outpatient services is $1. Prescription drugs are $1. Again, here, nursing facility residents are not subject to co-pays. Next slide. I want to spend just a little bit of time on this slide because we hear a lot of issues with this. Dental providers cannot submit a claim to or demand or otherwise collect reimbursement from a Medi-Cal member or beneficiary if it's a covered dental service under the Medi-Cal dental program. In other words, Medi-Cal beneficiaries should not be paying for dental services because the dental services should be covered. There are instances in which an individual might receive services that are not covered by the Medi-Cal dental program, but the provider is supposed to outline what those services are, and then the beneficiary is supposed to sign off that they understand that they can be billed for those services. So it's really important to note that if you're getting a bill from a provider of dental services, that the only time you should get a bill is if that's for a non-covered service. The issue in the dental program that we have seen is that because of a lot of administrative obstacles with the program and barriers to the program, because coverage was not previously comprehensive, all of these kind of factors mean that a lot of dental providers would submit prior authorizations or claims to the Medi-Cal dental program and be denied over and over and over again. And not because it wasn't a covered service, but because maybe they filled out the paperwork wrong. So a lot of providers sometimes stopped submitting claims altogether, or they would tell their patients that it was not a covered benefit, or they did not get approved by the dental program, and then they would charge the patient. Well, that's illegal. They're not allowed to charge a patient for a dental covered service. So it is really important to remember that if you're getting a bill for dental services, to double check it to make sure that it is not the provider is not charging you for services that should be covered, and that you actually signed off on, or your client signed off on, services that were beyond coverage of the Medi-Cal dental program, and that they approved getting those services. Really important there. Next slide. That section there really goes into the appeals and grievances under the Medi-Cal dental program. Next slide. So every time you need a service that needs prior authorization, so basically the Medi-Cal dental program that is administered by Delta Dental has to make a decision about whether they're going to approve a service. The provider has to submit a prior authorization to Delta Dental, and then they get back what's called a notice of authorization. So they submit a TAR, or a treatment authorization request, and then they get back what's called a notice of authorization. That notice of authorization will either approve or deny the service that was requested. If it is denied, then the individual patient, the Medi-Cal beneficiary, should also receive a notice of action. So anytime a prior authorization is submitted and it is denied, then the beneficiary should also receive a notice of that denial. So both the provider will receive a notice of the denial and the beneficiary. And then the beneficiary and the provider both have appeal rights. The provider can resubmit the claim if it was a technical error, or they can appeal the actual determination that it's not a covered service or shouldn't be a covered service. Why this is so important is that this is where if you're getting a bill from a provider that you owe something for a dental service, if they're telling you that it's because the Medi-Cal dental program denied the service, the beneficiary should also be getting a notice. And if they haven't gotten a notice, that's a fishy situation. Either the claim wasn't submitted and the provider didn't actually do what they were supposed to do, or the beneficiary is not getting their notices from the department as they should be under their due process rights. Either way, we want to make sure that people know that they should be getting notices and then they have appeal rights. And what that notice of action does is it triggers the appeals process. Next slide, please. And that appeal process is, your right to file a state fair hearing, or you appeal and they make a determination, and then you have a right to a state fair hearing. So all of the normal appeals processes get triggered there. And if it's through a managed care plan, a managed dental care plan, you have the internal appeals process through the managed care plan. So all of the normal appeals processes get triggered. In addition to the appeals process, I wanted to highlight the dental grievances process as well. This is when you have just a general complaint or grievance regarding either the program itself or with a specific provider. So you're supposed to, or the department suggests that you try to resolve any complaints or grievances with the provider to begin with. That you don't have to do that, but they recommend it. And then if it's not resolved to your clients what they would want, you can submit a complaint to the Medi-Cal Dental program by phone or through their complaint form. They must then acknowledge a written complaint within 5 days and then must inform a conclusion within 30 days. And then if the beneficiary is unsatisfied with that conclusion, they have a right to file for a hearing. And then that triggers, again, the appeals processes, which you can get a state fair hearing, or if you go through the department or through a managed care plan, goes through the Department of Managed Health Care appeals process for plans. I want to point out the grievance process too, because we do hear a lot of issues around providers with regard to quality of care or doing the wrong thing or charging for services that shouldn't be charged. So you can also, in addition to appealing a service, you can also file a grievance regarding a specific provider. So we really do encourage that. A grievance is also something that could be filed with regard to language access issues, which we are going to now transition to.
Great. So if we could now have Dorina join us.
And thank you, Amber. So good morning, everyone. Sorry for that slight technical difficulty. My name is Dorina Wong. I'm the director of our Health Access Project at Asian Americans Advancing Justice in LA. Legal and civil rights organization serving the Asian American, Native Hawaiian, and Pacific Islander communities in the country. And our Health Access Project recognizes that, AA and HPIs have a rich and diverse culture, languages, and health needs that are often invisible in our healthcare system. So our project mobilizes our community to advocate for their rights, to lift their voices, and share their stories to build a more equitable and inclusive healthcare system where all communities of color can thrive and live healthy lives. And so, language access rights has been one area that we've been working on for a long time, justice and specifically with the Health Access Project. Next slide. So I just wanted to make sure we're all on the same page about, the population that we're talking about, today, about who's considered limited English proficient. And this definition has been included in different guidances in Department of Justice, Health and Human Services. And it basically refers to individuals who do not speak English as their primary language and have a limited ability to read, write, speak, or even understand English. And in across the country, it's a pretty large population. So if you look at the population that speak a language other than English at home, that's about 64 million people, or about over 21% of our population. Of those, there's around almost 26 million who we would consider limited English proficient. And by that, we mean they speak English less than very well. It's a term in the census that you can look up, but that's a very large percentage of people. And even in California, we have 16 million, or 44%, that speak a language other than English at home. And of that, over 6 million, or almost 42%, are LEP. Next slide. And so we thought we wanted to go over about why language access matters. And I think probably many of you would know these kind of reasons why it's so important to provide language assistance services to LEP individuals. There's public health reasons. As you know, the Institute of Medicine report in 2002 recognized health disparities and cited language access as a challenge. So in order to eliminate health disparities, based on race and ethnicity and other socioeconomic factors, including language barriers, we need to ensure that limited English patients have language access to the services. There's also kind of a business case around why language access should be ensured. As you know, the changing demographics of our country, We have many immigrants coming to this country speaking different languages. So especially in newer parts of the country, even in the Southeast, where in order to meet the needs of this new population, and in order to ensure consumer satisfaction and patient satisfaction, the providers should ensure that language access to their patients is guaranteed. Also, there's marketing reasons, especially for health plans and health insurers. In order to meet and attract new members, they have to provide services in the different languages that their population speaks, in their service area. And there's also risk management issues, of course. In some ways, it's kind of logical, basic common sense that you have to be able to communicate with your patient, right? And so in order to ensure that the patient complies with the treatment or does what they're supposed to do, or even to get a correct medical history, you have to ensure that you can understand what the patient needs are. And in order to reduce errors in medical malpractice, you have to make sure you understand what the patient is saying to you. And also, I think in terms of cost reductions or cost savings, it's often kind of hard to figure out what those cost savings are because it's hard to calculate a negative, right? Most people think in terms of providing language assistance, in terms of how much does it cost to provide for interpreter services or translation of materials, and they don't really measure like what the cost effectiveness is of providing language assistance. The avoidance of going to the emergency room or the patient coming back repeatedly if they understand what you're trying to, what they're supposed to be doing. And so we just think that there's a strong business case for that. And also, just in general for quality improvement and quality insurance, there's a lot of monitoring of patient satisfaction, patient outcomes to eliminate health disparities, as I said before. And there's many state agencies that are now monitoring these issues. Next slide. So let's go through some of the language access requirements or guidelines. There's some federal and state requirements. These 6 will be specific ones that we'll be going through. And so next slide. Let me just start by going through Title VI of the Civil Rights Act of 1964, and hopefully many of you have heard about this. We've been trying to increase patient awareness and provider awareness of this, so people know that nobody can be discriminated on the grounds of race, color, or national origin. And national origin has been interpreted to protect limited English proficient patients. That is, you cannot discriminate on the basis of language. And this is a very broad rule and pretty broad law. And it applies to any health provider that receives any kind of federal funding from the federal government. And that is, public or private entities. That includes, so that if you receive Medicaid funding, and in California, that's Medi-Cal, Medicare, or even under the Patient Protection and Affordable Care Act, the ACA subsidies. If you receive any federal funding, you are obligated to comply with Title VI. It applies to state, county, and local health agencies and welfare agencies, clinics, dental clinics, providers like dentists and their staff, managed care plans, so in Sacramento and LA County, that would be the plans. And it would apply in the oral health context to Delta Dental, who receives federal funding through Medi-Cal. And so, and in California, most of the beneficiaries are fee-for-service, so that also would apply to the, Department of Healthcare Services, who oversees the dental program under Medicaid, under Medi-Cal. And so they're all required to comply with Title VI. Next slide. Next slide. Okay, so what's prohibited practices? These are just kind of general prohibitions. So you can't provide services that are more limited or lower in quality. That's kind of self-explanatory. Or have any unreasonable delays in the delivery of services. So let's say you can't make an appointment for somebody and say, oh, I'm sorry, we don't have an interpreter, you'll have to come back. You're not allowed to do something like that. Can't limit participation in programs. Say you don't provide interpreter services, so they can't participate in that particular program. And then, importantly, you can't require a limited English proficient patient to provide their own interpreters or to pay for their interpreters. And so, in order to get some understanding about what Title VI compliance would mean, different federal agencies, their Executive Order 13166 required all federal agencies to come up with a language access plan for their own agencies, and also for their federal fund recipients to understand what their recipients were required to do under this law. And so they issued their LEP, limited English proficiency guidance. So the one that's relevant to us is the one that's issued by the U.S. Department of Health and Human Services in 2003, and basically it goes through balance, kind of explaining what the obligations are of the provider and what the rights are of the LEP patient. So it balances 4 different factors. It looks like balances all these factors in a totality of circumstances test. The factors are things like the number or percentage of LEP persons who you serve, how, the frequency, so how often do they come into your office, the nature and importance of the program. If it's an emergency service, obviously that's more important than maybe just like something on an outpatient basis. And then the resources that are available to the recipient, so that a larger entity would have more obligations than a smaller entity, like say a dentist's office versus a community clinic or even a hospital. So the idea under Title VI is to take reasonable steps to provide meaningful access for LEP individuals, right? And so that means that you have to provide competent interpreters and translators for, translating written materials. You should not use minors or family members. And then the translation of vital documents. And vital documents means any documents that affect your legal rights or obligations. That could be applications, enrollment forms, notices that you might get, or changes in benefits, consent forms, things like that. Next slide. And then it also kind of it described a model linguistic access or language access plan, or the different components of an effective plan, and basically, hopefully, the health entity would already have a plan in place. So you should assess the language needs of your patient population, right? What languages do they speak? And you should describe what kind of policies they should have, and the types of language services available. If you don't have bilingual staff, you contract with a telephone interpreter line. How can the staff obtain these services? We know that there is a provider hotline that provides language interpreter services for providers, for dentists, but many people don't know it exists. Many providers, dentists don't know it exists, and their staff don't know. So, and how do you ensure the competency of your bilingual staff or interpreters, right? And so the third important part is to train your staff. As I said, if the frontline staff don't know how to get an interpreter, then they're going to probably send that person away and say, oh, we'll come back later when we can have an interpreter for you. And so you have to make sure that they know, like what the number to call for that hotline is to get an interpreter, and how to kind of communicate with that interpreter, with that LEP person. And then fourth, now LEP persons, that patient, LEP patient has to know that they have a right to this free language assistance and how to get that. We've been trying to, raise the awareness of LEP patients, but it's hard. A lot of patients do not know what their rights are. A lot of providers don't know what they're obligated to provide. And then finally, as we said, demographics change. You have to monitor and update the plan because your patient population might change. Next slide. Okay, and so how is Title VI enforced? Well, individuals can file, a complaint with OCR. Filing a complaint sounds like a large thing, but it doesn't really mean like it doesn't even have to be a certain form. It could be just a letter describing, what happened. and actually other people can apply on your behalf. That is, if you're more, if the patient's more comfortable going through their local community-based agency, that CBO can file the complaint for them. And actually, and once an investigation is filed, the OCR is obligated to investigate. And then the OCR also can actually initiate a compliance review on its own. If they see, let's say, in a newspaper article, some egregious case, they can actually go in and investigate on their own. Now, OCR has the obligation to provide technical assistance and training, before they impose the sanctions, because the big penalty in this case would be to take away all the federal funding, and the entity usually does not, do want that. That's a very, very, very harsh penalty, and so I would say 99.9% of the time, or even almost 100% of the time, they come up with resolution agreements and work with the entity to come up with a solution. And then finally, the enforcement of this has been limited so that private individuals can't actually file a lawsuit because of a U.S. Supreme Court. It's just made it a little harder. It has to be intentional discrimination. Next slide. Next slide. So I just want to go over 1557 of the ACA, because it incorporates all the non-discrimination provisions of Title VI. So all these things I've said about Title VI applies under Section 1557. It also extends the protections of Title IX, Section 504, and the Age Discrimination Act. So that means that race discrimination is prohibited not only on race, color, and national origin, but also sex, age, and disability. And for the first time, sex has been covered in the health context. And so it applies to health exchanges created by the ACA. And it, like Title VI, it requires meaningful access to LEP individuals. Next slide. And so all of these requirements, I'm not going to go over most of these because it's exactly what's required in Title VI. The one I will point out is that it does require health plans to post notices, not only plans, but also, the Department of Healthcare Services and Delta Dental to post notices of non-discrimination and taglines in top 15 languages. So that's much more than the threshold languages that are under Medi-Cal. The next slide, under the Medi-Cal managed care requirements, there's thresholds here for transition materials, covers 10 languages in LA, 11 languages, in various counties throughout the state. But, and I'm not going to go through it, but you can see how it's very exacting what is required in terms of translation materials. Now, for oral interpretation, I have to say, we want to make sure that if you need an interpreter in almost any language, unless it's a rare language, you should be provided an interpreter. Next slide. Now, I just wanted to mention the OMH class standards because it also is just another way to remind healthcare providers that they're required to provide kind of effective, equitable, understandable, access, including language access or specific requirements under these standards for all healthcare entities and providers. They're specifically for that mirror Title VI, and these are requirements as well. Next slide. Next slide. And I wanted to mention the government code 11135 because it is an important state requirement. California, we're lucky to be in California. There are a lot of language access requirements in California to protect LEP patients, but this one is similar to Title VI. It allows actually a private right of action, unlike Title VI, and it prohibits discrimination based on race, national origin, and there's an ethnic group identification or color specifically includes language, and it also prohibits discrimination based on age, sex, and disability as well. And it applies to any entity that receives state funding as well as a state agency. Next slide. And then finally, I want to just go through quickly a couple of just other state requirements. The Diamond Aleatory Bilingual Services Act was one of the earliest statutes around requiring language assistance. It requires state and local agencies to employ a sufficient number of bilingual personnel in public contact positions to ensure access to their services by employing, if a substantial number of non-English speaking persons, come into their offices. So for state agencies, that's 5%. Local agencies get to determine that. So there's some local jurisdictions like Oakland and San Francisco that have local ordinances that have different thresholds. And basically, you have to provide, if you can't provide bilingual staff and interpreters and translation materials. And then finally, for Senate Bill 853, this was passed in 2003, and regulations were issued in 2006, which established standards. But it basically requires all managed care plans, including the dental plans, in Sacramento and LA County, that they have to have a language assistance plan that's approved by the Department of Managed Healthcare, or if they're regulated by the California Department of Insurance, they're very similar regulations. And it's to ensure that LEP persons have a quality and accessible health care, and that, the communication and language barriers can't compromise the patient's health care. So I know I had to go through this very quickly, and, these might be the first time you've heard about them, but, hopefully this is a kind of a basic, fundamental kind of exposure to these, and I'm happy to answer any questions you have. And in terms, you'll learn more about how to enforce these. Amber did go through how to enforce some of these, but I think we'll repeat that, in later on. So I'm going to just now turn it over to Mariana.
Hi, everyone. Good morning. My name is Mariana Yamamoto, and I'm part of the Health Access Project at Asian Americans Advancing Justice LA. So today I'll be walking us through 2 community stories related to language access. And as we talk through these cases, I urge you to think about all the content that you heard from both Amber and Dorina, and think about what you could do to advocate for appropriate language access services and language assistance for any clients or community members that you know. And in addition, as Carolina mentioned at the beginning, if you have any stories or experiences of your own, we'd love to hear them and talk through them with you as well. Next slide. So this first case is from a family based in Ventura County. A Spanish-speaking parent made an appointment with a local provider for their child. The parent was asked for an interpreter for their appointment in order to be able to fully understand what was happening and all the treatments that their child was receiving. However, the dental provider did not call the Medi-Cal dental provider hotline in order to request an interpreter, and asked the parent to bring their own interpreter to the appointment. Luckily, the parent was able to reach out to a local community-based organization who was able to help and accompany the parent to the appointment and provide in Spanish. A few different things I want to highlight for this case. First, it was really fortunate that this community-based organization who shared this story had the resources to support and send a staff member to accompany the family to their appointment. Unfortunately, this isn't always the case, and we don't want this to happen to other folks. Members, as Dorina was mentioning, members should never be asked to bring their own interpreters. Those with LEP have the right to free qualified interpretation for their appointment. And also, cases like this demonstrate how the importance of educating our community members and advocates, as well as providers and everyone in their office, about the language access rights of patients, how to work with individuals with LEP, and where to request interpretation services through the Medi-Cal dental program. So below in the advocacy tips, you'll see 2 phone lines, both one for providers and one for members, where people can call. I'm pulling up a little bit, so hopefully this works out a little bit better. But where folks can call to request interpretation. So then the last piece that's on this slide as well is that in the case that language needs are not met, it's important that you let someone know. you can reach out to any of us, and any of our organization will be able to guide you to somewhere where you can report these issues or raise it so that this doesn't happen to anyone else, and also for future appointments that families are able to get interpretation for all of their appointments. And there are a few numbers here, both from the Medi-Cal dental program for the dental managed care plans, as well as the Department of Healthcare Services, Office of Civil Rights, and the Department of Health and Human Services Office of Civil Rights, where folks can call and report these issues and file something so that we can make sure that everything is okay for future folks. Next slide. So then the second case is very large and complex, and a huge thank you to the team at Maternal and Child Health Access. So MCHA received a call from a monolingual Spanish-speaking client who had gone to the dentist throughout 2018 and paid $2,800 for Medi-Cal covered services. The client had been told by their dentist that the TAR, a treatment authorization request, had been submitted and denied. So they ended up paying for these services out of pocket. However, when this client came to MCHA and the advocate and the client called Medi-Cal together, they found out that a TAR was never submitted by the dentist in 2018. So they were able to receive a reimbursement packet for these out-of-pocket payments that the client had done. However, when they saw that when the packet arrived in the mail, they found that all the documents were written in English. And so the client and the MCHA advocate called the telephone service center a second time to request that the reimbursement claim forms be walked through and provide site interpretation or site translation for the client so that they know exactly what they're filling out and where to fill it out. So unfortunately, for this case, the client wasn't able to get full site translation of the documents, and some really important parts of these documents were skipped over, including their legal rights. And the client was also explained to that when, hello? Oh, are we off again? Can you hear
You're there.
Oh, okay. Just, sorry, my computer did something funny. So then we found out that when the client was filling out these forms that they could respond in Spanish, however, it might take additional time for the response from the department. You can see there's a few additional details on the slide here that I didn't go over, but I encourage you to review these. There are a number of issues and key pieces that I want to highlight here. But one big thing is that, if you ever do see a community member or client being charged for a covered service, that please look into it. This is, as Amber was mentioning, this is a red flag, and so it is worth investigating a little more. The second issue is also something that Amber had raised, but whenever a treatment authorization is submitted and a service or a TAR is denied, both the provider and the client should receive a notification for that, and that kind of acts as a receipt for the client. The third piece is that whenever you receive any documents from the Medi-Cal dental program, it should come with a taglines document. So this document it talks about how if you speak a language, another language, and need language assistance, and sometimes they flag that this is an important document that requires a response, they should tell you in language what number to call and where you can access language assistance services. And the example below is an example of what it could look like. And that should be provided in the 15 threshold languages. And the last one is, whenever you are you are receiving site translation or the client is receiving site translation of a document, they should be walked through line by line through the entirety of that document to make sure that they know exactly what the content is and that they're reviewing it to its fullest extent. And with issues like this, if there are any, if the client is interested in filing a complaint, they are able to do that through the numbers and the different departments listed in the previous slide too, and that can be done in conjunction with a reimbursement. Not necessarily, you don't have to do one or the other, but you can do both at the same time if that's what you would like. Next slide. Next slide.
I think we're at it.
Oh, got it.
So this is Amber again. I'm just going to go over quickly some of the points that Mariana and Dorina made about language assistance and where to get it. Just to reiterate that individuals in the Medi-Cal program, and specifically we're talking here about the dental program, have access to interpreter services. They are not required to bring their own interpreters. They should not be turned away because they do not speak a language that the provider does not speak. Instead, members can call the Medi-Cal Dental Telephone Service Center, or if they're enrolled in a dental managed care plan, and obtain interpreter services, and the member bulletin is provided there as a resource. Providers in the Medi-Cal Dental program can call the provider telephone service center and either request an interpreter or use an interpreter service through the telephone line. If there are any issues with obtaining an interpreter, a complaint should be filed with the Department of Healthcare Services with the Medi-Cal Dental program, and the phone number is listed there. If an individual is enrolled in a managed care plan in LA and Sacramento counties, they can file a complaint with the dental managed care plan. There can also be a complaint filed with the DHCS OCR, phone number there, or Health and Human Services OCR. And then there's also a phone number listed here for the Health Consumer Alliance, which is an alliance of a number of legal services programs across the state of California that focus specifically on improving health access for Medi-Cal recipients, and that phone number is listed there. Next slide. So on this slide are our contact information for each of our organizations. We have all been very much engaged in improving access to oral health here in California through the Medi-Cal Dental program. So each of our numbers are listed here. I'm not going to go through them all, but the slides will be sent to you after the presentation. So this is MCHA, the Health Consumer Alliance. Next slide. Asian Americans Advancing Justice, CPEN, and Us at Justice and Aging. Next slide. This is the member pamphlet that a group of us put together that has been translated into different languages that explain for beneficiaries how to use their Medi-Cal Dental program benefits and then their rights in accessing those benefits through the program. And it again is translated into multiple different languages and available on the CPEN website in all of those different languages and can be printed in this really pretty format. Next slide. Then just a bunch of resources here on how to get engaged on oral health. You can sign up for the California Oral Health Network. Smile California is the Department of Healthcare Services, the Medi-Cal program's outreach plan and outreach for dental specifically. There are a lot of resources on that website, including member-facing materials. We've created an advocate's guide to dental benefits that's available on our website. There's the member pamphlet that we just looked at on the previous slide. And then the DHCS Medi-Cal Dental website is a lot of information, including the beneficiary handbook, the provider manual, which has almost all the rules for the Medi-Cal Dental program, and then provider bulletins that are specific to providers. Next slide. And then these are all of our 4 websites. Again, you can obtain after the presentation. And then finally, next slide. We will open it up for some questions.
Thank you, Amber. Thank you, Mariana. Thank you, Dorina. And thank you all who have joined us for this webinar. We want to take a minute to allow folks to ask any questions that they have about this issue, about language access in oral health. While we allow folks to think about a question that they might have, I'll kick us off with the first question, which is, do these same requirements apply to sign language services?
Hi, this is Doreen. Am I coming through?
Yep.
Oh, great. Yeah, well, some of them do. Title VI, I think, applies to American Sign Language as well, and there are additional requirements for ASL under like the ADA, the American with Disabilities Act, and I think even the Rehab, Section 504 of the Rehab Act, that are even more specific than what I went through. And in fact, I think there's even more of an awareness around the provision of American Sign Language or than for actually like non-English languages. But yes, at least the Title VI applies. When they're talking about interpreters, I think that they usually include ASL interpreters as well.
Great, thank you. Second question is, can a complaint IMR be submitted directly to DMHC for Denti-Cal fee-for-service cases where the client is not enrolled in a plan?
This is Amber. No, the IMR process is only available in managed care context, so it cannot, that complaint process is not available to individuals who are enrolled only in fee-for-service.
Great. And next question is for a participant that wasn't sure if they missed this, but are there any provider bulletins or materials or manual sections that instruct them on their obligation to coordinate interpretation services? And this participant noted that advocates might find this useful to have to distribute to providers.
This is Amber. I can't remember what slide it was, but there are the provider bulletins that describe the interpreter requirements and language access requirements for providers. And a reminder provider bulletin just went out recently within the last month on that. So yes, to answer the question, yes, that is available.
Great.
I will also,
next question.
Hey, Carolina, this is Amber again. I do want to emphasize that if you are experiencing client access, language access issues with your clients, we really do encourage you to contact one of our organizations. We want to make sure that we're tracking these issues, particularly systemic issues that are arising, to ensure that we're getting them fixed. So this is an outreach event to provide some education and ways to advocate, but if you're seeing this on a regular basis, we certainly want to hear about it.
So important. Thank you, Amber. And on that note, our last question is about a person's individual challenge. So they shared that at their office, they're having issues with getting interpreters. So I'm guessing that this might be a dental office. This participant shared that we are always told someone isn't available and they cannot confirm that an interpreter will be there. What do we do in these situations? Reschedule the patient, file a complaint, or are we required to provide an interpreter even if the office needs to pay?
Dorina or Mariana, you want to take it?
Hello? Can you hear us?
Yeah.
Oh, we just disconnected a little bit. This is a hard issue, because we understand that the limited resources that maybe a dentist office may have, right? But as I said, the obligation, especially under Title VI, applies to any of the entities that receive federal funding. So it would apply to the dentist office, to Delta Dental too, who oversees the program, right? And even DHCS if it's fee for service. So I would say that if if they had to, it would be best if they paid for it rather than making the patient go home and come back, or the patient pay for it. But they definitely should, we should file a complaint or contact Delta Dental and DHCS and tell them that there's this problem, this issue with the unavailability of interpreters when they call that hotline. And we would certainly support, I think, support their efforts to try to make that hotline more responsive and ensure that the interpreters are being provided, because they are actually, so we could file a complaint against Delta Dental and or DHCS to make sure that providers really have access to, to the interpreters, because it's what they're supposed to be providing.
Great, thank you. Another question is, we've got a lot of questions here, so really glad that we have this time together to talk about any people's experiences. If your client is a member of an MA plan and it requires its members to see a non-Denti-Cal provider, who would provide coordination of benefits services in the client's native language?
This is Amber. There are so many tricky issues here. First of all, it's not clear to me that they have to go to that Medicare Advantage provider first if they're getting dental covered services. I kind of hope that this person reaches out to me directly on this question, because I would like a few more details on that. Because the standards in terms of language access are, the same as Dorina mentioned. The state requirements could be a little more hazy with regard to an MA plan operating in the state, but the general access issues for Medicare Advantage enrollees are the same. So it depends on, I think it's both, but it's complicated by depending on who is going, what the person's going to each of the providers for first. If they're only going to the MA dental provider, then it's the Medicare Advantage plan and their process that you'll have to work with. If it is really going to a Medi-Cal dental plan, then our Medi-Cal dental provider, then it's through Medi-Cal. But this is super complicated because of the MA enrollment. So if you want to reach out to me individually, that would probably be best.
Great. Yes, please don't hesitate to reach out to any of the panelists or organizations that were on the call today. This is a really complex issue, and so we want to make sure that we can field any questions or provide any type of support. Another question that we got from participants is, do you advise consumers that have managed care dental coverage to contact their health plan for interpreter services?
Yes, if they're having trouble, let's say with the dentist, the managed care plans are supposed to be providing interpreter services availability to the network providers, right? So theoretically, they should be providing the dentist with a number to call, a telephone interpreter number to call to get an interpreter. So, but if the patient or client is having trouble, let's say the dentist is calls the managed care plan and the managed care plan is not providing an interpreter, then yes, I guess you can have them, try to, they could try calling the managed care plan as well, and try to ask, why aren't they providing interpreter service, or file a grievance or complaint with the managed care plan.
Carolina, are you there?
Oh, yep, I'm here. Another participant wanted to share a resource called Pals for Health. It's an organization here in California that offers training for bilingual individuals who would like to enhance their language skills or explore a career in interpretation. Great. Well, I think those are all of our questions for now. Want to thank all of you for joining us for this webinar on language access and oral health. Please do not hesitate to contact any of us with any individual stories or questions or things that you'd like to discuss, because we know that this is just the beginning. So, yeah, thank you.